Buenos días a todos.
Good morning to all. I do believe we have quorum in order to continue with the 19th session of the Subcommittee on Program Budget and Administration. Good. Welcome back, everybody, and happy to work forwarding what we did yesterday. We're going to begin with item 3.1, which is the draft proposed strategic plan of the Pan American Health Organization 2026-2031. I'd like to draw attention to the document SPBA 19.2 and invite Mr. Ronnie Maza from the Pan American Health Organization to come up to the head table and to present this agenda item.
Good morning. Thank you, Madam President, Director, head table, distinguished delegates. It is indeed a pleasure to present an overview of the proposed new strategic plan of the organization and give you some highlights as the document continues to be built. Just as of, which is a product, by the way, the progress you're about to see on this document is the product of great collaboration, a great engagement, but also that a relationship that we enjoy with our member states as PAHO, the organization, with your secretariat facilitating, serving you to ensure that the document responds to the times and needs, to the current times and needs. And thus, this document that we were just working on the last week because of that consultative process, engagement process that we have with you. Up to last week, we had the fourth consultation, and therefore, you saw the complete document published last week around Thursday or Friday. And therefore, this document, just to caution as well, that is a work in progress. It is also has benefit from input not just from member states, but also from stakeholders. So we're building on the lessons, the experiences that we have with our strategic planning, but also that solid results approach that our member states and our peoples deserve to continue improving, innovating for greater impact in our countries. With that, let me share some slides, some highlights of what is in the extensive document before you. So as a way of the overview and why this document? Well, it is a requirement, set the requirement that the organization presents to member states every 6 years, a strategic plan that sets a medium term strategic direction of the organization. So we're looking here towards 2025 to 2031. And therefore, while looking at the situation also, the opportunities in building forward. It defines the collective, and this is important, that it defines the collective priorities and results of the organization, that of member states across the region. And of course, with the Secretariat looking at the evidence that we have to ensure that those priorities and results are also realistic, but in line with what we're seeing in the landscape, both in public health, but also those external factors that impact on public health. It looks to build, and that's something that our member states have highlighted from the lessons we have documented and on how we demonstrate, again, the organization's unique value added. How do we drive impact in countries? How do we measure that and demonstrate that indeed there is greater impact at the end of 2031, that we have moved the needle towards improving health and well-being across the region and in each country of the region and territory in the region? How do we address the gaps? How do we address the inequities that continue to persist across the region, across the countries, but also within the countries? But it also responds, and this is important, that we remain country-focused to country priorities first and foremost, but how those country priorities and those commitments also respond to the commitments you have made at the regional and global level towards 2031. You will see that this goes beyond the 2030 SDGs because we need to go beyond that as we plan here in the region. And how do we remain true to respond to the health situation that we're seeing? But building on lessons learned that we have documented but also want to remain true to is the external evaluations. This organization, under the leadership of Dr. Jarvas, is now has strengthened the evaluation function, external evaluation function. And how do we look at that evidence? How do we look to that external view and recommendations, and that allows to improve how we work here at PAHO, how we deliver with your member states and the partners. The external audits as well have been considered, and also our internal reviews, because we do have a practice here, and just 2 weeks ago, our director held the 6-monthly performance review on how we implement our operational plans. We have also been looking at that to inform the plan. The plan needs to respond to the situation. As we do in any plan that we develop, we first look at the diagnosis. First, the context. And this context, of course, goes beyond health. The political, geopolitical landscape, the health situation, and other external factors that impact on health, as we know the determinants. We have, and we must celebrate, the great strides in improving health and well-being in the region. The Americas continues to be a pioneering region that shows the world on how public health advances could be made through elimination of diseases, but also reducing mortality and morbidity. The toll of the pandemic has been analyzed carefully, and as you know, and we have documented this extensively, the region was affected more than other parts of the world. We have looked at the health-related targets, how much progress we have made. There's a lot of progress, but also challenges, both in the region and globally. The determinant, and when determinant is social, but the commercial determinants, the risk factors, the barriers that prevent achieving or reaching those that is not easy to reach to, and those persistent gaps that we need to address. And also the vulnerability, and when we speak of vulnerability, environmental, but also social, and all aspects that impact on the health of the people, be it by natural phenomena or catastrophic events that are impacting the people's health. When we look at the mega trends, we have also, in a document, you will see an extensive situation analysis that look at the demographic shifts, for example, the aging of the population in the region, the political changes in the region. How do we manage that? That is a constant. We see as democracy, as our director always reminds us, how do we continue to work with our member states to ensure that the people's health needs, the well-being are at the center and the priority of what we respond according to our mandate. The economic forces that also affect health, the commercial determinants in particular, technological advances and risks, but while we look at the risks, also the opportunities of harnessing the power of innovation. The social and cultural shifts, that's important as we look at health, intricately related. And of course, the environmental changes. And the impact on health and well-being, we see, and we analyze in that chapter that you will see, ongoing challenges on how we orient health systems that are more integrated and address indeed the first care level through a primary health care approach. The access barriers that exacerbate inequities, and how do they prevent us from moving forward in effectively tackling communicable, non-communicable diseases, mental health that continues to see a challenge, and the health through the life course. So a comprehensive and integrated approach to respond and address the needs of the peoples. The multiple health system challenges and how they prevent progressing towards universal health. And again, looking at closing gaps. And how can we be more effective in reaching and accessing health technologies, health medicines, advances in science that can really benefit the people's health and well-being. Apologies. At the end of this strategic plan, and in line with its aim, we seek to leverage PAHO's unique position to ensure that the peoples and communities in the region enjoy optimal health and well-being, and to make your secretariat, the PSB, the Bureau, fit for purpose to work with you, to work with our partners, to accelerate progress towards a healthy Americas and equity and resilience. And you will see across this document and in the discussion and that process with the member states and our technical teams is on how do we accelerate, especially as we recover and build forward. As we move to the timeline, just to highlight here that this is the roadmap that our member states approved in the executive committee last year. So 9 months later, we celebrate the great progress we have made in achieving those milestones. As you will see from the timeline, we have reached milestone 2, and we're moving forward to develop the first full draft for the executive committee, and therefore the opportune timing here to present to you the progress, but also get your guidance, your insight on how we continue to build this document with the input, of course, of our member states. As you will see in the roadmap ahead, we have at least 2 more consultations with our member states. The consultative process will continue, but not just with member states, with the stakeholders. We have also received great participation from the stakeholders. This is something that we added in this cycle of the strategic plan. And using technology, it has allowed us to reach and get more input from across the region, from stakeholders and our member states. Important to note here as well is that as we develop the strategic plan, we need to develop the first program budget, and I will speak on that on the subsequent item. The goal here is to reach September with a solid document that responds to the needs of the countries and the region, member states. Just to highlight some of the progress that we have made since you approved the, since you saw the update, in September at the Directing Council, and remaining true to the commitment we made to you to continue improving, innovating for greater impact. We have advanced on the development of the theory of change. These are pathways to show on how we reach those goals, those results that are outlined in the strategic plan at the level of the outcomes and an overall theory of change that will be developed for the strategic plan. The country strategic input, this is in getting the input from our member states, in building from a bottom up, from a true member states input. Consultations, so in addition to the collective consultations we had as members in the sessions that we've been holding almost every month, we have had our country offices under the leadership of our PAHO representatives, what we call the country strategic input. This is an innovation that we put in to gather input from our member states directly, one-on-one, on where do they see that PAHO's technical cooperation should be directed, and what is that opportunity to build on that. And that has been used as an input that inform the development of the strategic plan, the outcomes and the scope that is before you. We have also created, given that addressing equity in the region continues to be a priority, created a health equity working group to look at all the dimensions of equity and how they can be incorporated into the plan. We have had 2 sessions. I believe there are 8 member states in that, and we thank them for their collaboration and their input. And we will have 1 more session with that working group to ensure that we're very clear on what we mean by equity in health and addressing the inequities, on closing gaps. We have advanced in the development of document. At this time, we are about 2/3 of the document, based on that great progress we have made with you and your input. In addition to getting the consultations every month, we really thank the member states who provide written comments, extensive written comments, for us to then look at the document and come back to you. That iterative process has been very rich indeed. We are conducting country prioritization, again, building with our countries. Some of you, I understand, have been involved already with our country offices in reviewing the priorities. This is a time to really focus on priorities. We don't have all the resources. If we want to have greater impact, we need to focus on priorities, and that rigorous approach and systematic approach we've developed in the region has proven to be very effective. And we thank again the member states who have engaged with our teams at country level to have those consultations. To date, we have 30 of the 51 countries and territories that have completed this. We aim to get, according to our records in the past, to about 90% of that, with which we are about 45 to 46. We would like to reach 100%, but the timeline sometimes does not allow. But if we can get to a 90%, we'll be happy. Aiming to 100, happy with 90. In terms of the member states and stakeholders consultations, and I just want to clarify here, consultation member states is a member state-led process. The input from member states is consultation. We have informative sessions with stakeholders, because the mandate comes from our member states, of course. We have developed, in trying to communicate as well, a PAHO strategic plan website where you can see, and others can see the development in a transparent manner on how this document, and also make suggestions. We have also, in improving our way of communicating and refining our results approach, we have revised the PAHO results chain. Again, we have presented this in the consultation process, and we have refined the definitions to ensure that we are clear on what we mean by what the Secretariat also is accountable for versus what is joint accountability with our member states at the outcome and impact level. When it, in terms of the summaries that I just wanted to share with you of what is coming from the member states consultations, is that member states and stakeholders appreciate the higher strategic orientation of the plan with the 5 strategic objectives, the more integrated approach. Our member states have also highlighted the importance of the strategic plan to build on a principle of this organization, a value, Pan-Americanism, regional solidarity and cooperation, and how to continue building on that so that we can deliver on the results proposed in the strategic plan. An integrated and results approach has been welcome, and we will continue refining as we move forward. And also the emphasis on specific topics. Our member states are coming back to us and says, okay, please elaborate and be clear on conceptual aspects, equity, well-being, determinants, and how the strategic plan will respond to that. When it comes to the outline, and this, the SPBA will usually present an outline to you. At this time, we are presenting content to you, not just an outline. Content because we've been able to build, again, with that rich process with our member states. As you can see from the table of contents there, we pretty much have all sections. I'll highlight that under the regional agenda, we are working on the integrated approach on equity. That's something that we're still work in progress. And in the appendices, you will see the detailed details on the results framework. We are working as we speak on outcome indicators. That's something important, ensuring that we have targets, baselines. We have had a rigorous process here in the organization that every indicator must have a baseline target. We must have data to measure. That's a lesson that we have documented and ensure it will not reoccur, because in the current strategic plan, we had several indicators that we committed to, but data was not available. So we cannot measure with any progress. So building again on that evidence and results approach. We continue to work on the theory of change, and that's something that we aim to have in the next month, so that you can also see the pathways on how we will work together to achieve those results proposed in the strategic plan. And this is a diagram that, again, we developed to better communicate our integrated approach, but also results with that vision in the middle to improve health and well-being across the region, but also the outcomes, the results approach through the outcomes, and then the outputs that will be in the program budget. The results chain of PAHO is combined of 3 levels: impacts, outcomes, outputs. Just to note that the outcomes and the impacts are in the strategic plan, and the program budget brings the biennial outputs, which are developed in every program budget that's presented to you every 2 years for your approval. Going a bit deeper into what's in the document, and you will find a detailed section for every outcome on what's in the scope of each strategic objective, you will see that under each strategic objective, there are outcomes, 2 or 3 of them, and under that outcome we have the scope. For instance, Under the first strategic objective on health equity, social determinants, risk factors, climate change, and health, the emphasis there will be in reducing the health inequities, addressing the determinants and risk factors, promoting health and well-being, and adapting to and mitigating climate change impact on health. This is the impact on health that we must respond to. Under the strategic objective 2, resilient health systems and services based on primary health care, we're looking at driving transformation of the health systems based on primary health care. Again, the emphasis on primary health care that has been the focus of discussion of many fora, just at country level and regional level. Ensure that there is availability of critical resource. Human resource for health is a priority the member states continue to highlight. Financing, technologies, and information systems. Digital transformation is another priority that your member states have highlighted, and there's also an emphasis in that strategic objective with regional innovation and production also of medicines and technologies. Another important priority and one of the pillars of our director's priorities for the next 4 years. Under the strategic objective that focuses on disease prevention, control, and elimination, and please note, this also covers the NCDs and mental health, to intensify the efforts to keep moving that momentum of the elimination agenda that your member states have also approved a couple of years back, to prevent and treat communicable diseases, non-communicable diseases, and mental health conditions. The emphasis on mental health has been something that has been discussed as a high priority, and also other conditions. Improve on response to violence, traffic accidents, injuries, and AMR, antimicrobial resistance. Under health emergencies, we continue to build on the strength of the region, reinforcing capacities, address gaps to prevent, mitigate, prepare for, and ensure that we're ready, building on the lessons that we had from the COVID, but also other emergencies. Ensure rapid threat detection, assessment, and response to health emergencies and disasters. And on the fifth strategic objective, where the Secretariat looks to also with your member states, improve PAHO's leadership, governance, and performance. Performance for results, of course. Strengthen the strategic and enabling functions so that we can continue to be agile, fit for purpose, but also efficient, transparent, and accountable to your member states, and systematically improve, innovate, modernize our management practices. You saw some of those examples that our director presented yesterday of initiatives that are looking at that under the PAHO Forward initiative. When we look at measurement, important that we also build on the lessons and best practices. Here is a snapshot of where we are and in terms of the numbers of the indicators that we have at each level, and we have put there for reference what was there in what is currently in the strategic plan that we are going to conclude at the end of this year, but also the WHO General Program of Work and indicators in numbers. So as you can see, currently, the current strategic plan has 7 clusters. We don't have strategic objectives. We group the outcomes into 7 clusters. We propose to have 5 strategic objectives in the new strategic plan. At the level of outcomes, we have quite a disaggregated number of outcomes. That's something that we have integrated. And those are now 12 outcomes, higher level results-oriented outcomes. At the impact level, we have currently 28 impact indicators in the strategic plan at this time. The proposal is 18. We have reduced by 10 there, again, focusing on what needs to be measured, what is important, and linked to the aim of the strategic plan and that vision of the strategic plan. And at the outcome indicators level, you can see also a reduction from 99 indicators to 84 indicators, a 15 indicators reduction. You can see the numbers of WHO. WHO also has 5 strategic objectives, or strategic priorities as they call them. At the outcome level, they have 18, we have 12. And at the outcome indicators level, they have 97, and we have 84. We are continuing to refine these numbers. And please rest assured, as we see room for improvement, and we welcome your feedback as you review the list of indicators. Also, we welcome your feedback on how we can continue to refine those measurements. In closing, just let me note here the next steps. Refining the indicators, as I was mentioning, ensuring that they are measurable, realistic, attainable, ensuring that we have a compendium. There's a a rich experience here in the region, a best practice, that we don't just develop the indicators with baseline, we make sure we define them. And we have what we call fichas técnicas in Spanish. We call them a compendium of indicators in English, where you detail where is the source of information, how do we measure it. Everybody understands how this is being measured. And this is something that has been very useful in doing the joint assessment of outcome indicators with our member states over the last 10 years. The sections of the document will be completed based on your guidance from this meeting, but also based on the additional consultations, refining the theory of change, and outlining accelerators. An important aspect of this plan, as you notice from the theme, is where do we have the opportunities to leverage innovation, to leverage new ways of doing work so that we can accelerate progress. So something new that we're looking into, again here, in collaboration with all the teams here at your secretariat, but also with you. We will be discussing that in the subsequent consultations as well. We will review our assumptions. I want to caution here that, as you know, every plan needs to be, it's not static. We need to remain responsive to the situation. So we're looking at our assumptions, foresight methodology to ensure the plan is future-proof. And also, a recommendation that came from the external evaluation is of the current results approach is that we have mechanisms in place to adjust the plan during implementation, both with criteria. And that's something that is built into the plan. So if anything happens as a good planning exercise, we should review and adjust so that the plan remains true to the times, but also not just changing the goalpost for the sake of accommodating a result. And finally, closing with the results-based approach. We will update this based on all this rich input and experience that we have. Members, these delegates, just to highlight here, we continue to communicate through the website. Everyone can see this. And we also have developed some communication materials. Communication is important. Our deputy director always reminds us we need to communicate, especially our results in health or proposed strategies. And there's a website for the strategic plan as well. With that, I'd like to thank you for your attention and looking forward to address any questions, comments. Welcome your comments and suggestions so we can continue building forward this document, this strategic document that's important for the region, but most importantly, the peoples we serve. And hopefully, by the end of 2021, we can see that horizon in improving the health of peoples, especially for the new generations. Thank you so much, Madam President.
Thank you very much for a very comprehensive presentation, and I guess there will be some comments about it. So, me gustaría conceder la palabra al Pleno para cualquier comentario que hubiera. So, por favor, México tiene la palabra.
Gracias, Presidenta. Muy buenos días a todas y todos. La Delegación de México agradece la presentación del documento y reconoce la importancia del proyecto de Plan Estratégico 2026-2031 de la OPS como un marco integral para orientar los esfuerzos regionales en materia de salud. En este sentido, valoramos la alineación del documento con la Agenda de Salud Sostenible para las Américas 2018-2030 y con los Objetivos de Desarrollo Sostenible, así como su énfasis en la equidad en salud, la resiliencia de los sistemas sanitarios y el fortalecimiento de la gobernanza en salud pública. Al respecto, con beneplácito mencionamos que México ha participado.
Perdón.
We have a problem with the interpretation. We're being asked to provide a few minutes, so we're fixing the problem. Can you hear us? This is the English channel. Can you hear us? Yes, thank you.
Mil disculpas, podemos
We apologize. We can go back to the Mexican delegate. Thank you. It is with pleasure that we say that Mexico has participated in the 4 consultations with member states regarding the development of this plan and has agreed on the need for having indicators that are aligned with the needs of our countries. In this regard, we believe that it is highly relevant to further reinforce some of the axes that Mexico considers to be relevant, such as having greater detail in concrete strategies for health equity and reducing social and economic gaps, strengthening the infrastructure on our primary health care, sustainable financing, and retention of the health personnel, more attention to antimicrobial resistance and mental health, and the prevention of non-communicable diseases through fiscal policies, a more robust approach on health regulations, and preparedness in situations of crisis, greater strategies, and more specifically in order to close the digital gap on health and to improve the interoperability of information systems and to reinforce road safety with impact and intersectoral strategies. Taking into account the fact that the last consultation with member states was just held on March 13, Mexico will share with the governing bodies a document with detailed comments about this proposed draft. Thank you and congratulations for the presentation.
Muchas gracias.
Thank you very much, Mexico. I now give the floor to Canada.
Thank you very much, Madam President. Canada thanks the PAHO Secretariat for presenting this draft proposed strategic plan. We appreciate PAHO's efforts to actively engage member states and other partners on this important document, and we look forward to continuing this consultative process in the lead up to the strategic plan's adoption in September. Thank you.
Muchas gracias.
Thank you very much, Canada. I now give the floor to Guatemala. Thank you very much, Madam President. On behalf of Guatemala, I'd like to address our gratitude to Dr. Ronnie Massa for presenting this draft proposed strategic plan 2026-2031. We would also like to apologize for the absence of our Minister, Joaquin Barnoya, who had planned to be present for this discussion, but because of urgent commitments in Guatemala, it has not been possible for him to be here. We greatly value PAHO's effort in order to articulate the strategic plan in keeping with the roadmap approved in September last year and the lessons learned from the current strategic plan until 2025. We welcome the implementation and the use of statistics, which will allow better articulation and following up on the progress made in the region. In this regard, the alignment between the funding lines and the expected results is crucial in order to ensure the goals proposed and the indicators. We want to say that the new strategic plan ought to consider flexible strategies, as was mentioned by Mr. Massa, that will give continuity to programs whose financing has been canceled or reduced because of the current juncture. The health crisis created by the pandemic left essential lessons, and it also bared that we can adapt to current challenges. We cannot allow to go back on the progress made on matters of public health. In that regard, the success of the implementation of this plan depends on the commitment of member states with their objectives and the support provided by people responsible for implementing these programs. In particular, the strategic objective 5 on leadership, governance, and performance of PAHO ought to reflect the commitment of the organization with the sustainability of their interventions in the region and with the stability of the human resources. In that regard, it is essential for states with the support of the leadership of PAHO to continue working and continue promoting active participation of the region in PAHO's and WHO's governance, making sure that the contributions and priorities in the region will be duly represented. Madam President, on the other hand, and in line with the strategic objectives of the plan, we reiterate the interest of the member states of COMISCA in strengthening technical cooperation with PAHO, which has been key in order to beef up our capacities and respond to health challenges with the solutions that are in keeping with our realities. To conclude, we reiterate Guatemala's commitment with consultation processes and participatory construction of the strategic plan, and we hope that the framework will guide efforts for the benefit of health and well-being of our peoples. Thank you. Thank you very much, Guatemala. I now give the floor to the U.S.
There we go. Thank you, Madam Chair, and good morning, colleagues. The United States recognizes the consultative approach used to develop the strategic plan and appreciates this update and the work of Ronnie and the entire Secretariat team in bringing us this far along in this really important exercise. As we know, non-communicable diseases are the leading cause of death and disability in the Americas, responsible for 65% of deaths in the region. The strategic plan presents a crucial opportunity to integrate bold, evidence-based NCD policies into regional health priorities. Improved access to primary health care, along with prevention of sickness through the promotion of healthy lifestyles, can help slow the rise of NCDs. We must redirect the focus towards understanding and drastically lowering chronic disease rates and ending childhood chronic disease. And this includes fresh thinking on nutrition, physical activity, healthy lifestyles, over-reliance on medication, the effects of new technological habits, environmental impacts, and food and drug quality and safety. The United States notes the strategic plan's focus on efforts to contain and eliminate diseases and strengthen readiness and response to health emergencies. Madam Chair, my delegation is concerned, though, to see that the strategic plan fails to use precise language regarding the biological reality that there are two sexes, male and female. President Trump has set a clear and overdue course correction on gender ideology, and we must acknowledge the biological realities of sex. These sexes are not changeable and are grounded in fundamental and incontrovertible reality. When discussing sex-based distinctions, PAHO should reconsider the use of the term gender in all applicable policies and documents, including the strategic plan. We look forward to working with PAHO and other members to ensure all PAHO programs defend women's rights and protect freedom of conscience by using clear and accurate language and policies that recognize women are biologically female and men are biologically male. U.S. funds will not be used to promote gender ideology in defiance of biological reality, nor on radical and wasteful DEI programs. In addition, DEI and DEIA policies threaten the safety of men, women, and children by diminishing the importance of individual merit, aptitude, hard work, and determination when selecting people for jobs and services. People should not be stigmatized, demeaned, or shut out of opportunities because of their race or sex. Accordingly, it is the policy of the United States to promote individual initiative, excellence, and hard work, and to reject DEI and DEIA initiatives. In conclusion, the United States urges international organizations to avoid divisive cultural causes and maintain focus on their core mission. These constant forays into controversial social issues, at odds with the sovereign prerogatives of member states, represent one of the main reasons President Trump ordered an examination of U.S. participation in multilateral organizations. Madam Chair, my delegation looks forward to continuing to work with other member states and the Secretariat to further refine the strategic plan in the coming weeks to ensure that it responds to member states' priorities and leverages PAHO's unique value. Thank you, Madam Chair.
Thank you very much. Brazil?
Brazil has the floor.
Muchísimas gracias.
Thank you very much, Madam President.
We thank Mr. Massa for the presentation on the draft proposed strategic plan 2026-2031. Brazil appreciates the continued opportunities to discuss and contribute to the development of the plan. We particularly acknowledge PAHO's efforts to incorporate the feedback provided by member states, and we also recognize the importance of consultations with stakeholders. Brazil recognizes that we are on track to having a coherent plan that is highly supported by member states, reflecting the priorities and most pressing needs of the region for the next 5 years. We highly value the evidence-based, results-oriented approach and the centrality of indicators. Since the document presented before is of a substantive nature, we'd like to take the opportunity to reiterate and highlight some comments on certain areas of the strategic plan. Regarding social determinants of health and risk factors, we recommend including the vulnerability of persons with disabilities, considering their intersectionality with other social determinants and ensuring more comprehensive and inclusive health policies. While recognizing the central role of primary health care, we suggest also addressing essential specialized care and continuity of care, which should be supported by the integration of information and technology advancements across the entire health system. It also supports strengthening measures to prevent and control risk factors for NCDs. This includes expanding policies on regulating ultra-processed products, restricting harmful product advertising, and appropriately taxing tobacco, alcohol, and sugary drinks. We particularly suggest strengthening the focus on the impact of early exposure to NCD risk factors, especially amongst children and adolescents. In light of environmental challenges affecting public health, we would also like to highlight the importance of addressing the growing impact of plastics and electronics on environmental contamination and human exposure to toxic substances. Brazil also considers it crucial to have a specific focus on indigenous health, given the significant disparities in access and quality of healthcare, particularly in neonatal and child care. It will allow for more in-depth discussion on targeted strategies to ensure equitable and culturally appropriate care for those populations. We further suggest strengthening vaccine safety monitoring and promoting vaccine confidence, as well as the inclusion of indicators related to health workforce, particularly regarding training and continued education to ensure preparedness and rapid response to future endemic and pandemic events. In the field of health surveillance, we suggest that actions go beyond early detection to also include prediction of public health events, using tools capable of identifying early changes in the occurrence patterns of health events captured in health information systems. Finally, Madam President, Brazil reaffirms its commitment to strengthening public health policies in the region and our active collaboration with PAHO to ensure a robust, inclusive, and effective strategic plan aimed at achieving the objectives of the Sustainable Health Agenda for the Americas 2018-2030 and the Sustainable Development Goals. Thank you.
Thank you very much, Brazil. Now, Netherlands, please.
Thank you very much, Madam President. On behalf of the Kingdom of the Netherlands, I'd like to thank Ronnie and his team and everybody involved for your hard work with regard to the development of the strategic plan. We value the efforts you have taken for bringing us as far as we already got, and really appreciate your active engagement with the member states during the various consultation rounds. The Kingdom of the Netherlands is looking forward to continue working with PAHO in the development of the strategic plan. Thank you very much.
Thank you. Si no tuviéramos ningún...
Should we have no additional comments, I'd like to give the floor to Mr. Massa so that he can respond to these comments. Thank you very much, Madam President.
Thank the member states, 6 member states who made your interventions, first for your words of encouragement and appreciation. It really helps our team continue with the energy that is needed to drive this. And I'm sure we speak here of the entire PAHO team, not just in this room, but also across the region in the country offices. As I said, the 3 levels are really working together here to ensure that we deliver on that commitment to your member states of a high quality, the strategic document that responds to your needs and priorities. There are some specific points that we take note on and that we will analyze and ensure that we can come back to the member states in that process, the consultative process that you have approved. We invite you to also send the written comments. We still have some time so that we can benefit from that rich input. And when we have the 5th consultation, we present to the member states in that spirit of dialogue and building together, that we will have then a detailed discussion in that forum so that the member states, as is, can have that opportunity, just here in the SPVA, but also the wider member states membership, to review and discuss and agree on a way forward. I just want to reiterate our commitment here to continue refining the document with that results and evidence-based approach, but also concepts, ensuring that we have clarity on concepts. There's a glossary of terms as well. And also on the opportunity with the working group on health equity, where we're also looking at definitions and specific approaches on how to address the key issues mentioned. We welcome the words of bold action, opportunities. This is what we're trying to incorporate in the strategic plan, because really I don't think the health and well-being of our peoples can wait. And that's the spirit of that message, and we welcome that. Data, yes, important. We continue to look at that, and that's, and again, as we move forward, an advice is if we don't have the data today, that we work on that so that we can have it as a matter of priority, so that we can continue not just measuring, but showing where we direct our interventions on an evidence-based approach. Sustainability, I welcome that, observation on how we ensure that we also are sustainable in our interventions, but with resources, and you will see in the subsequent item that the strategic plan will need the resources to implement it, and also that your secretariat continues to remain responsive. Sustainability is indeed important, and governance and leadership. With that, I would just, and also to invite you, if you haven't done so, the prioritization. The prioritization will be key as we guide our interventions. Thanks again to member states. We continue to be engaged with you, and we look forward to hearing your additional comments, but also your participation in the upcoming consultation that we will have with you. Thank you, Madam President.
Muchas gracias, ingeniero.
Thank you very much, Mr. Massa. Any additional comments? Should there be none, then I'd like to give the floor to Dr. Barbosa.
Madam President, I want to thank our member states for the comments that they present today, but also for their active participation in this process. I think that I want to commend our member states and for this process, because I think that's very important, that we cannot only repeat the process that we had 7 years ago in a bureaucratic way. I think that it is really important that our member states are proposing a totally different approach. I think that a much more strategic approach for our strategic plan. The reduction in the number of outcomes from 28 to 12, I think that is really an achievement, because this really is meaning that we are not fragmenting our priorities. I will tell you, I have many years working in public health, and sometimes I could not identify what were the difference between 2 or 3 outcomes that you had in the current strategic plan. So I think that this was a fragmentation of the process. Now I think that you are proposing a strategic plan that clearly is strategic, and at the same time appointing to the Secretariat what are the priorities that we want us to develop during the 6 years. So I think that this is really important. Second, that also this strategic plan is incorporating some lessons that you learn. We cannot have an indicator that you don't have data to measure what's happening. So when we put an outcome, an indicator, we need to be sure that we have the data to follow up, to measure the progress, to identify the gaps, to see how we are progressing. So it's not a wish list, but it's really how we can translate our priorities, the common priorities that you have in our region, to a strategic plan. I think that it's very important, many comments that you made highlighting some aspects of the plan, some changes that you think that are important to be made. We will have 2 rounds of consultations, and of course, if you need more, we will have more. Our role in this process is to facilitate, is to bring you together and to listen and to try to facilitate the process to achieve consensus. It's not easy, because we are talking about a region that is very diverse, as you know. So the priorities sometimes are not exactly the same when we are talking about the Caribbean countries, the countries in Central America, South America, in North America, Canada. So, but I think that, again, with this openness and at the same time this constructive attitude that you have demonstrated clearly so far, I do believe that with these 2 consultations, and if you need more, we will have more. But we will get a consensus and to approve a strategic plan that will guide our action during the next 6 years. 6 years that will be very important. We are still recovering from some several negative impacts of the pandemic, as you know. In many countries, the maternal mortality, that's an excellent indicator of access and quality of care, doubled during the pandemic. We had the mental health emerging as a very serious problem during the pandemic. We have many people with non-communicable diseases that postponed their diagnosis, treatment, surgery. So the backlog in many countries, including developed countries, now is a big problem for the health system. We need to rethink how we can strengthen primary health care to really be the first line closer to the community, but also that can offer health promotion, surveillance, prevention, diagnosis and treatment for the most common diseases that you have, like diabetes, hypertension, and others. So I do believe that the challenge that the region will face the next 6 years with the discussion that you are providing and the guidance that you provide to the Secretariat approving the SBPA in our directing council, I think that it will be really crucial. So let's get the best of these months that you have ahead to increase the dialogue, to increase the receiving contributions from our member states in order to build the necessary consensus about the main aspects, the main priorities that you have in this SBPA. Thank you, Madam President.
Muchas gracias.
Thank you very much, Dr. Barbosa. I would like to inform the subcommittee that the discussions will be reflected in the final report. Should we have no additional comments, we move on to the next agenda item 3.2. Outline of the program budget of the Pan American Health Organization 2026-2027. I would like to bring document SPBA 19.3 to the attention of the subcommittee, and I invite Mr. Ronnie Massa. He's already here with us, by the way, so maybe he can introduce this agenda item. Thank you very much, Madam President.
Mesa Directiva, delegados.
Distinguished delegates, head table.
I'm pleased to introduce this item 3.2, which is an outline of the proposed program budget of the organization for the biennium 2026-2027. This is the snapshot of the roadmap that we have also developed based on the overarching roadmap of the strategic plan. So we break down here. You will see some overlaps, of course, because this is being developed concurrently. And just last week, we also had the opportunity to share the proposal that is before you, also in the wider consultation process with our member states. As we speak, we launched the prioritization again, with the emphasis that the budget needs to be responsive to priorities, but to the realities. We launched the prioritization last year with our member states, and that's going to be critical to inform also the budget, not just the overall budget envelope, but also the allocation of budgets at outcome level. We are presenting to you in the SPBA the outline. This is still a very general document as is required, but we also bring some content to you, as you will see in the document. This month, we will continue with our internal discussions. We already had the consultation last week with the member states. And during April, June, as you can see, they're turning the curve as we get to the straight line of June to September, is that we finalize the full document that you will see in the Executive Committee. But there's an important date there, which is the WHA, the World Health Assembly. As you know, our PAHO budget, integrated PAHO budget, incorporates the AMRO portion, and that decision of WHA usually informs also the PAHO budget. From June to September, we will pretty much be working on refinements. So we hope that after the Executive Committee, we will basically work on specific fine-tuning, especially if something emerges during those 2 months, so that we can have a document well in advance for you to review in detail before the September Directing Council. Important, it doesn't stop there. Once you give us that approval, our member states gives us the approval to proceed, we develop operational plans. So we translate your mandate into specific work plans that each entity in the Secretariat develops and our director approves so that we can implement the specific interventions, working with you at the country level and here from the region. The outline before you is a standard document with an executive summary. We look at the programmatic context, the strategic direction of the strategic plan, of course, the proposed budget, and again, just some of you may be new to the concepts here. PAHO budget is an envelope, it's not funding it. We look forward to funding it, but this is an envelope as we speak. Then we look at financing. I will present an update on that. Important in the contexts and that we have adopted also this good practice of looking at risks and mitigation actions as we implement the plan. Accountability continues to be an emphasis and commitment to you to improve where possible. But accountability for results and financial resources, one, the Secretariat, as we look at the results approach, but also with our member states, as we also look at outcomes and impacts, that joint accountability that we do together, an assessment, a good practice that we have in the region. The outcomes are going to be finalized in the strategic plan, and then we have to develop outputs. We are already in that process with our technical and enabling teams to ensure that we have outputs that also are aligned with the proposed strategic plan. Strategic considerations are always important on how we develop the program budget. This is going to be the first program budget of the new strategic plan, so it gives us that opportunity, again, leveraging opportunities on how do we accelerate in the first 2 years of the strategic plan. How do we put in the foundations, the necessary interventions, so that we have conditions that will allow us to propel forward and aiming towards the 2031 targets in the strategic plan, jointly defined, of course, with our member states. Building on the resilient health systems on a primary healthcare approach remains at the center of the sustainable development, but also health for development, health security, and so on. Incorporating lessons learned also important. We continue with that practice in the program budget, and that we address the relevant decisions and recommendations that have come up, including from this from your guidance in this forum, but also in the consultation member states. Increasing timely and equitable access to health innovations, again, leveraging the power of innovation in health for all countries in the region, to ensure that they reach all those who are not being reached at this time, also through the implementation of specific interventions. And of course, again, ensuring that we remain true to you every opportunity we have of making PAHO modern, agile, responsive, focused on results, demonstrating that contribution at country level, that we are indeed moving the needle, but while we do that with efficiency, transparency, and accountability. In terms of the budget envelope, the space, as you can see here, it's a flat budget in base programs. That's the blue bar, the bottom. At the time, this is about 2 months ago when we were considering this, we felt that the demands are there. We cannot ignore the demands for technical cooperation from our member states. The priorities are indicating that we need to protect at least the base budget. The other special programs, emergencies segment, that's a placeholder. So we don't normally focus on that. Based on what we can project at this time, we'll continue needing about $100 million as a placeholder in the event of any emergency or crisis that we need to respond to mobilize those resources. In terms of how this program budget should be financed, and again, these are estimated preliminary figures that we have at this time. As you can see, our director, as already mentioned, is not requesting an increase in assessed contributions. Assessed contributions remain at $194.4 million. The budget miscellaneous revenue increases. Our projection at this time is that it will increase to $52 million from 14. This is due to the investment environment, higher interest rates as we see, and we continue to invest better here. The voluntary contributions that PAHO mobilizes, and this is important, as you will see, that we are inviting our member states. In addition to the traditional voluntary contributions, we're asking our member states, while we don't ask for an increase in assessed contributions, we're inviting your member states to contribute with core voluntary contributions. We appreciate the traditional approach with voluntary contributions. They are very valuable, but if there's a space for any member states to also contribute with core voluntary contributions, which means they're flexible, to be oriented to the priorities that you define to implement the program budget and strategic plan, we welcome that approach. This is something new that we're incorporating in the PAHO, because we do need those resources to continue to responding to you as you deserve. The other one is the WHO allocation, where you can see those two asterisks, because that's an interim amount, still under discussion. The recommendation, as I mentioned yesterday, from the executive board in WHO was that they set a budget at $4.9 billion in base programs, but subject to subsequent consultation with member states. There is a request to WHO that the budget also looks at the financial outlook in a realistic manner. So the reduction already shows that, a slight reduction to the region, but also it also shows the importance of the allocation to the region. And again, this, in an integrated approach to our budget, this budget space is approved so that we can implement and respond to the priorities of the countries of the region. It's an integral part of PAHO's budget. So the AMRO allocation becomes PAHO budget once it is adopted. However, as we know, this is the budget as the WHO, if that was to be approved, as mentioned yesterday and highlighted by our director, that budget space from WHO barely reached about 65% funding. So when that doesn't come, the PAHO voluntary contributions, your PAHO team has to mobilize additional resources. And that's the effort that we normally see, that the PAHO voluntary contributions, that 23%, would likely go up because we would have to cover for the gap that doesn't come from WHO. And again, I want to appeal on the core voluntary contributions where possible, and we can have discussions, of course, on that with our member states. Now, important, as we highlighted yesterday, and you see the flat assessed contributions for the last, now it's 13 years, going for 14 years. And by the time you approve this program budget, the assessed contributions would not have increased for 14 years. And we estimate the impact of that in real terms is a reduction of about $75 million. That is a big toll. And while we continue to invest in efficiencies and your PAHO teams continue to do everything possible, something has to give. We focus on priorities. We find innovative ways of working. I can tell you the collaboration member states, when somebody was asking me, a delegate was asking me yesterday, how do you do this? Well, we do it by, first, the collaboration member states. There are innovative ways of working with member states when we do country interventions, or member states sometimes co-finance activities at country level. We use technology to do what we have to do. But the impact is there. And while our director and management continue to be very prudent in managing these resources that you entrust upon us, we need your resources. We need your assessed contributions, and hopefully we can get some core voluntary contributions in addition to the traditional voluntary contributions. With that, I'd just like to highlight a few steps here. We would have by next month a document that will be consulted with you with more details before we get to the executive committee. We will then incorporate any final decisions that member states make at the World Health Assembly in terms of budget. It will not affect our priorities. Let me be very clear about that. It's a budget space. It does not affect the content of the program budget when it comes to the programs and the priorities that PAHO will put there based on consultations with you. Completing the prioritization with member states also by next month, and developing and completing something that we always try to innovate here with the limited resources, and using technology, a digital portal where we can make all of this information available to you and our stakeholders, where you can reach it by the click of a button. With that, I thank you, and I look forward to hearing from your comments and questions.
Thank you very much. Ahora
I now offer the floor to the plenary for the discussion and to hear your comments. El Salvador has the floor. Thank you, Madam President. Thank you, Ronnie Massa, for the report. El Salvador is grateful for and acknowledges this presentation. We are also grateful for having the term innovation incorporated. This is a very interesting topic today. It's fashionable, but we also have an observation to make. Although it is true that there is still a 42% of contributions by WHO, I do believe that the reduction, even if minimal, is nonetheless it's important to stop it from decreasing any further. As you mentioned in the May World Health Assembly, it will be important for PAHO member states to express our support to avoid any further decreases and to maintain the level of the contribution. Furthermore, we want it to be more attractive for others. Frequently, we think in traditional terms, but sometimes the vision needs to be changed. Let us turn into greater attraction how to raise additional funds, perhaps show changes in the communication strategy so that it can be more attractive to external sources so as to attract more funds for our strategic plans, which we do support because they are aligned with our strategic lines in our countries, in all the member states. So thank you very much. I thank El Salvador and recognize Canada.
Thank you very much, Madam President. Canada would like to thank the Secretariat for this outline of the program and budget for 2026-2027. We recognize the particular importance of this program budget, as it will be the first under PAHO's new strategic plan. In reviewing the different financing sources for this proposed program and budget, we note a significant decline in funds from PAHO voluntary contributions and other sources compared to the current budget. Further, we see that WHO's allocation to the region continues to correspond to 42% of the PAHO budget for base programs, which remains a significant portion. Recognizing that the WHO budget will only be adopted in May, we encourage PAHO to continue to remain prudent, implement efficiencies, and continue to plan for potential gaps in funding. We look forward to seeing the detailed budget that will be presented to the Executive Committee in June. Thank you.
Thank you very much, Canada. Now, the United States, please.
Thank you very much, Madam Chair. We appreciate this program budget outline, and we look forward to further discussions and consultations on the proposed 2026-2027 program budget, especially once we have the full document for review. The United States notes that the program budget will reflect PAHO's strategic plan 2026-2031, and would refer to some of our comments on the strategic plan on the previous item. We would also urge caution in aligning the proposed program budget with WHO strategic priorities and work. The focus should be on the health goals and objectives of the region. And it was encouraging to hear that once WHO funds come to the region, it becomes PAHO. It becomes the PAHO budget, and so that is on the right track, and want to ensure that that continues to be the case. Looking at expected revenue for the budget, the proposal shows an estimated miscellaneous income more than tripling from $14 million to $52 million due to income earned from the previous biennium. And it was noted that this was related to investments. So could the Secretary please advise what kinds of investments this money accrues from, and why is it expected to be so much higher than the previous biennium? It's great to see expected increase in income, but that is a large increase, and in particular, since the increase in miscellaneous income is projected to help cover the gap of declining voluntary contributions. It will be important to understand how likely that is to happen. And we would also like to know if the Secretariat expects to have a more accurate estimate of that amount further down the line when the budget is presented for final adoption. Regarding national voluntary contributions, we are encouraged that the funds are subject to PAHO's financial rules and regulations. However, could the Secretariat please confirm whether these voluntary contributions are reported in the same way as other voluntary contributions within the financial reports? There are reasons to count all of the contributions together, but we want to ensure that we clearly define when member states are providing contributions that benefit the organization and others versus those that benefit primarily themselves. Thank you very much.
Thank you to the United States. Now I would like to give the word to Guatemala.
Muchas gracias, Presidente.
Thank you very much, Madam President. My delegation, first of all, would like to express recognition to the PAHO team for developing the program budget for 26-27. This is a significant effort given the current needs of member states when it comes to technical cooperation while seeking to optimize available resources in a context of financial challenges and circumstances. We recognize the versatility and commitment of PAHO staff, which have demonstrated exceptional skills to adapt, innovate, and maintain quality of their work despite budget limitations, and the fact that the assessed contributions haven't increased over a decade. The resilience of the organization and its capacity to provide effective cooperation is witness of its commitment for the health of the region. Guatemala welcomes the new financing modality through the basic voluntary contribution and a mechanism designed to reduce financing gaps and ensure the maintenance of the program budget. We hope this mechanism will also make it possible to expand PAHO capacities to respond to technical cooperation requests by member states and provide greater financial stability for the organization in the long term. Let us also underscore the importance for the program budget to maintain flexibility and be coherent with the priority of member states because each country makes it addresses its own resources, and we need all things to be focused on this. It is fundamental for risk and mitigation measures to contemplate not only health challenges but also socioeconomic and political risks that can impact implementation of programs. Strategic planning must include proactive mechanisms allowing PAHO and member states to anticipate and respond with agility to these challenges. In conclusion, we reiterate our commitment with PAHO's work and our willingness to continue working actively, advocating and defending the priorities for the region, as mentioned by El Salvador, and also ensure that there is equitable access in the health sector. Thank you. Thank you very much, Guatemala. Brazil is now recognized. Thank you very much, Madam President.
Mr. Massa, once again, for the presentation of the outline of the program budget for the next biennium. As recognized in the document, the program budget should align with the future strategic plan, operationalizing it, and other key thematic strategies and mandates. Brazil recognizes the great efforts made by PAHO leadership to propose a zero-growth budget for base programs and an overall reduction with respect to the previous biennium. While costs keep rising, especially in the headquarters, we must adapt to the realities of member states, including in many of them, a limited investment capacity in the wake of COVID-19 and other crises. Brazil specifically salutes the open and transparent manner in which the PAHO leadership has addressed the current financial challenges facing the organization. While the existing difficulties cannot be understated, this context can and should be used as yet another demonstration of the clarity of purpose and the ability to achieve shared objectives and goals in the Americas through evidence-based dialogue and cooperation. Brazil is confident that PAHO will come out stronger and with even greater support and trust by its members. Madam President, with initiatives such as PAHO Forward, we're glad that the organization has been able to achieve efficiencies and keep discharging its mandate to provide technical assistance to the region and helping build stronger and more resilient health systems. Also, Brazil recognizes the strong efforts by PAHO to diversify its sources of funding and support and encourages further resource mobilization. Finally, Brazil highly values the consultations taking place for the development of the program budget. We consider stakeholder participation a crucial aspect of the process, particularly in this moment when the organization needs to broaden its partnerships. Brazil reiterates its engagement with the design of the program budget and looks forward to the opportunities to contribute to the discussions. Thank you.
Thank you very much, Brazil. Would we have any other comment before opening to answers? Costa Rica, por favor.
Costa Rica is recognized. Thank you, and apologize for my late arrival. I was at another meeting, but yesterday we were talking about something that I wanted to comment upon. I think everyone is aware that geopolitical changes to a certain measure leads us to anticipate scenarios, and in doing so, we should have projections as to the sustainability in those scenarios of the strategy that we all are supporting and want to maintain, and that is PAHO. And given budget reductions, and especially knowing that all the entities represented here and all the members, what could be in those plans, A, B, C, D, what would be strategies to redirect what we support and have paid for this entity that collaborates with us and is strengthened and we have a close relationship with. So then we want that through PAHO that these resources be directed, but with us knowing that these two memberships we channel through one entity. That is a proposal, a way of validating and a way of knowing that you in some way won't face budget reductions in a region that does have major needs. Going beyond that, I do believe that in the dynamics of administrative and budget management for each of the countries, anticipation is important. If the changes are requested at a time when we need to generate change, you know that it will impact one budget year. That is where anticipation, I want to underscore this, is so important as well as budget projections. Let me give you this specific case of Costa Rica. In order for me to make a change in what we have, we're already looking at the modifications and budgetary figures to defend it in September in the legislative body so as to have the budget for next year. That shows the anticipation, the advance work. If we don't have a future vision of what needs to be done, the mechanics in each country is slow. We all know it. Public administration doesn't respond rapidly to the needs locally. And there is something else that I hope will be made clear, and this is the distribution of some budgets in strategic lines of work that we cannot do without, such as caring for emergencies and the visualization for surveillance of diseases throughout the region. So that's what I wanted to share with you. Thank you. Thank you very much, Costa Rica. If there are no further comments, I'd like to offer the floor again to Mr. Massa. Thank you, Madam President. And let me thank the 6 member states who have shared their comments, their inputs, suggestions, questions.
I think we have sort of reflections. Welcome the reflections. Welcome the suggestions on how we continue to ensure that the full document will consider all this input that you have given us, but also ensuring that it is a budget that is realistic, that addresses these comments you've made, and we made sure that we took note of that, but also in the subsequent discussion with member states, we'll see if there's anything else to fine-tune. But let me welcome first the encouragement for continuing innovating, to continue advocating, and please, we count on you, and we thank you for that advocacy with WHO as well. It has paid off. We showed you yesterday that we have been getting more resources, and yes, protecting the budget. It's already, as Director Jarvas mentioned yesterday, the region already has the smallest budget allocation among our regions, and that should not be affected anymore. We also take note of your advice on continued commitment to prudent management and to ensure that we consider scenarios as we move forward. Let me highlight here that the proposal before you, developed about 6 weeks ago, looked at the times. The financial outlook was an important, but also a historical budgeting approach that we use here, but also scanning the geopolitical scenarios, external factors. Those are considerations we have taken very seriously in the analysis, and will continue to do so as the times are very fluid. And the discussions in WHO are also, we will remain vigilant and ensure that the document will reflect what needs to. In terms of questions, I noted here 3 questions, specific questions. One is on the PAHO voluntary contributions. Let me just tell you, that's the budgeting part. That's to balance the budget, we put a smaller amount there because the AMRO portion is there at that 42%. The reality is that we mobilize more resources as PAHO voluntary contributions. The real funding will show that we mobilize more than that. Yesterday, our director was, in the financial report, you will see that we do mobilize more than what is put in the budget, pretty much as a placeholder, just to balance the budget and don't increase it because WHO's allocation is there to the region. And the commitment is to continue doing, as you say, diversifying, strengthening partnerships, and our colleagues in external relations and led by our director here and everybody here in PAHO, technical teams, country offices, everybody is doing their part to mobilize additional resources to respond to the priorities of your member states. Miscellaneous revenue, yes, indeed. Let me be very frank about that. One is the fact that we were very conservative in the past of putting a $14 million. Last biennium, as you will recall in the SPBA, we presented to you, last year, and the executive committee approved the revenue surplus, which exceeded $30 million. So we have been investing more, being more prudent with the investment of the portfolio, and in the financial report you would see those details on how those investments, the interest rates is one factor, but indeed it was also, the explanation is simple. We were conservative. We have been getting more returns on the investment, and this number just adjusts to the reality. It's more accurate. We will continue to review and update as necessary between here and June, but that's the closest, the best estimate we have at this time. You will also see details when we get to the closure of the biennium of what will be the projected revenue from that source also as we close the biennium through our financial reports. National voluntary contributions, the answer is yes. They must adhere to PAHO's financial rules. All funds that come to PAHO are managed, be it WHO, be it national voluntary contributions, are managed according to PAHO's rules and are aligned to PAHO's programs. It has to be aligned with the program budget and strategic plan. With that, Madam President, just to thank member states again, please continue to be vigilant with the discussions in WHO, and I will be in touch with you through the upcoming consultations, and looking forward to get your additional comments through that forum as well. Thank you, Madam President.
Thank you very much. Now, me gustaría darle la...
I'd like to give the floor to Dr. Barbosa. Thank you. Thank you very much, Madam President. I would like to thank all member states for their comments and their statements. We take due note of them. And it seems to me that with these, we are to improve the document that will be submitted to the Executive Committee. We are speaking of a budget that still has a significant level of uncertainty. It seems to me that in order to be very transparent with you, and depending on the discussions and what is to be implemented and discussed during the World Health Assembly, perhaps we will have to go through the document, review the document that will be brought to the attention of the Executive Committee. It is important to bear that in mind. The budget must always strike a balance between being realistic and at the same time having the ambition to mobilize resources in order to fill it up. Because this is an envelope. It is just an envelope, but we're not talking about the real funds in general. When you see the budget, the share from WHO is 42, but historically, we only receive around 60–65%. And in fact, we reach 1/3 of the real funding of the organization in real life. And because of voluntary contributions with the effort that we're deploying in order to expand the base of donors and partners,
de incrementar
we have a trend to increase these contributions. No doubt we will have to make some changes, but the proposal is to keep the same budget with a reduction on the emergency side of things, because since all the funds that have to do with the response to the pandemic are coming down, because we're no longer dealing with a pandemic, it makes no sense to maintain the same level of a budget. But for base programs, we maintain the same level with the expectation of what is going to happen with the discussions in the World Health Assembly. And I repeat, the commitment of countries in the region for a need of equitable distribution of resources.
Eu que também agradeço toda a
I would also like to thank you for all the suggestions, all your comments. We are very committed to continuing with a very prudent policy, as I said from the very beginning of my mandate, in terms of seeking efficiencies, reducing unnecessary expenditure, reducing the unnecessary bureaucracy, and to have a more efficient organization. The issue of a revenue surplus, which has already been explained by Ronnie Massa, you have to remember that for many years, the interest rate in the U.S. was zero, almost zero, and now it is no longer zero. So in a way, that helped us, and also in keeping with the recommendation, following a recommendation, let me switch to English.
external auditor, I made changes in our the committee that supervises the investment portfolio. So now we have external members, and being prudent, but now I think that we have diversified more our portfolio in order to protect and to benefit more from our investment. So this is the main explanation. Of course, we will not have the same performance next biennium, but I think that it's good to have this increase, this surplus, because it's covering all the gaps that we have in the financial situation for the year 2005. So this is allowing us to be more in a more healthier situation, let's say so, during this year. So I really appreciate all the comments, suggestions, and pending the discussions during the World Health Assembly. But I think that is at the same time a realistic budget, but a budget that is challenging us to mobilize more resources from voluntary contributions and other sources. And I just want to make maybe a suggestion. Let me switch it to Spanish. Muchos países.
Many countries, in fact, with the change in the contributions table within the UN, even with the approval of 20% in the quotas for WHO, in real terms, you will see a drop, a reduction of how much you pay. I wanted to invite those countries that have that reduction to transform that savings that you will be getting into voluntary contributions for PAHO. It could be a way of doing it. It is an expenditure that is already a part of the budget of the countries, and if you don't use it for that, you will be using it for other areas, and we could have that reduction that many countries will have as a voluntary contribution, so that we can fill up the gaps that we still have in our budget. So it is an invitation that I extend to you for more solidarity in the region. Thank you. Thank you very much, Dr. Barbosa. And if I'm not wrong,
Muchas gracias. Informal.
thank you very much. I would like to inform the subcommittee that the discussions will be reflected in the final report. And also, let me tell you that we will have a 30-minute coffee break. So we'll meet again at 11:10. Thank you.
Le estaba dando así picazón y arde mucho y no sabía si es esa enfermedad lo que tengo. Pero como cabal vinieron los personal de salud aquí en mi casa, entonces me detectaron digamos, el tracoma, que vinieron en el centro de salud y me hicieron la operación de mi ojo. Pues por el momento, y gracias a Dios que ya lo veo muy bien y ya no sentía esa, ¿cómo se llama?, la picazón, lo que me estaba dando antes. En cambio ahora sí ya me sentía bien por el ojo que me operaron. Y además estoy agradecido con el personal de salud y tanto la OPS que vinieron en el centro de salud, me hicieron esa operación y yo estoy agradecido con ellos por todo lo que me hicieron. Ahora soy libre del tracoma.
With the rising prevalence of non-communicable diseases, the Ministry of Health and Wellness believes, supported by the European Union's Health Sector Support Program, EUHSSP, and PAHO, is proactively strengthening its health system. Through the development of targeted policies and collaborative frameworks, the nation is addressing these challenges on multiple fronts. From integrated primary care services, building capacity of healthcare workers, to empowering communities, strengthening health systems, saving lives.
In Belize, over the last 5 consecutive years, non-communicable diseases have been in the top 5 causes of morbidity and mortality for our country. So we knew that we needed to address this head-on. We were able to successfully launch our nutrition policy, and we were able to put a nutrition plan with objectives onto this policy.
And the support that is being provided to the Ministry of Health and Wellness for the development of the National Cancer Plan and the National Cervical Cancer Plan will also contribute to ensuring the management of non-communicable diseases.
By defining clear objectives and strategies, we are building a future where NCDs are effectively managed and the health of our population is prioritized. Integrated health service delivery networks are revolutionizing healthcare delivery in Belize. By ensuring comprehensive care at the primary level and bringing services closer to where people live, these networks are making a significant impact.
Through integrating the comprehensive management of non-communicable diseases such as hypertension, cardiovascular disorders, also mental health conditions, this really helps to strengthen the capacity of primary care providers and also community health workers in the knowledge and understanding of prevention and management of these conditions.
By standardizing care with global best practices and introducing new treatment modalities, healthcare professionals are better equipped to manage chronic illnesses. Health education is a crucial element in preventing and managing NCDs.
Through PAHO, we have been able to successfully, over the last 12 to 18 months, do caravans in some of the least accessible places, very rural communities that had significant population. So the health caravans were basically a fair for the community to come out, learn more about health in different aspects. The blood pressure was done, your weight, your height, your body mass index. The pharmacist was there, nutritionists were there to give nutrition counseling. It was just an effort to try to improve health literacy in the hardest to reach populations.
By empowering communities with knowledge and education, we can inspire behavioral change and improve overall health outcomes. Access to essential medical equipment is vital in the early detection and management of NCDs. With the right tools, our healthcare providers are better equipped to serve the community.
There are a number of new blood pressure measuring devices that have come onto the market, but it is important to ensure that these are clinically validated so that the readings that we receive from them are accurate. In order to ensure that as we roll out the HEARTS initiative for the proper management and control of hypertension, we want to ensure that the equipment that are being used in the primary care facilities have been standardized.
The National Cancer Plan and the National Cervical Cancer Plan are groundbreaking initiatives aimed at reducing the burden of cancer across the country.
Through the EU project, PAHO has been able to give us tremendous technical cooperation for us to have a very solid and usable plan when it comes to reduction of all cancers, not just cervical cancer, but it's the National Cancer Plan.
The important thing about cancer and any cancer plan is to ensure that it is very comprehensive and covers the broad spectrum from prevention to rehabilitation and to care at the end of life. In addition to that, the clinical management. How do you diagnose? How do you manage these conditions? Which medications to use? So those are components that are also in the plan.
Together, with the support of our partners and communities, we are building a healthier, stronger Belize. One step at a time, we are ensuring better care for NCDs through integration in primary health care.
Amid a challenging security environment, vital work by the Ministry of Public Health and Population is strengthening routine immunization services in Haiti. Supported by PAHO and funded by the Canadian government through the Can Give initiative, these efforts seek to ensure equitable access to life-giving vaccines for vulnerable communities and groups, including girls and pregnant women. Through 3 regional exercises, 105 department-level trainers receive important updates on vaccination norms and protocols, including on COVID-19 vaccines, which have been integrated into Haiti's national immunization program. Through cascade training, these regional trainers then share their knowledge with nearly 400 health providers. In addition, 124 health providers involved in epidemiological surveillance were trained in specific protocols for surveillance of vaccine-preventable diseases. And 221 health facilities benefited from supportive supervision to ensure their compliance with vaccination quality standards. In 2024, more than 421,000 Haitian children received critical vaccinations through catch-up campaigns and routine services. And as Haiti faced recurring cases of deadly diphtheria, PAHO supported the vaccination of more than 340,000 children against the disease.
Oh oui, vaccin li gen an pile importance dans cadre routine et raison c'est parce que gen zone qui vraiment éloigné. Des fois, parents pas de possibilité pour les mener ti moun dans centre là pour les venir faire vaccin. Des fois, négligence parents tout et les nouveaux équipes sous terrain comme ça a vraiment aidé parents yo, aider ti moun yo pour capable faire un vaccin dans localité côté que yo vivent là.
Parler des maladies évitables à la vaccination, nous apprenons et diphtérie. Effectivement, c'est un cas de diphtérie suspect que l'équipe aidée là a fait réponse. Et nous en pleine activité de réponse. J'en ai remarqué, nous cherchons rougeole, rubéole, nous cherchons syndrome rubéole congénitale, qui est moins d'un an. Nous cherchons catankou paralysie flasse aiguë. Nous cherchons surtout Kaiti et moun qui gen moins que 15 ans.
HEARTS is an initiative of the Pan American Health Organization and the Ministry of Health, which aims to improve heart health and save lives by standardizing hypertension treatment, promoting healthy lifestyles, and strengthening primary health care.
The chronic non-communicable diseases are the leading cause of death in Grenada. Within the top 3, we have the cardiovascular diseases. For these reasons, we welcome the introduction of the HEARTS Initiative.
At the core of the HEARTS Initiative is the HEARTS Protocol, which provides a standardized approach to hypertension management and cardiovascular disease prevention in primary health care. It includes standardized treatment, effective and accessible medications, risk-based care, team-based approaches, healthy lifestyle promotion, and the strengthening of primary healthcare systems.
The integration or initiation of HEARTS has introduced a standardized approach to the way we manage high blood pressure patients.
The HEARTS protocol includes simple, standardized, proven treatments and interventions that can be easily incorporated into primary health care.
As part of the HEARTS program, we have standardized blood pressure reading, ensuring that all categories of staff know how to check blood pressure. So in case a patient comes to the facility, anyone can assist them in checking their blood pressure.
The HEARTS protocol emphasizes a team-based approach which expands the responsibilities of hypertension management beyond primary healthcare physicians to include nurses, pharmacists, nutritionists, and other healthcare professionals, so that they too play a significant role in saving lives.
As nurses, we ensure that our patients are compliant, making sure that they monitor their blood pressure as often as possible, take the medication, come to visit the doctor when they are low on the supplies, follow up with the nutritionist as well, and if they have any issues or concern that they are, feel free that they can come in. If they're not feeling well, they could come in at any time and speak to any one of us for advice, and we can do the proper referral if it's hospital or to doctor.
So as nutritionists and dietitians within the healthcare, whether it's primary healthcare or secondary care, we employ what is called medical nutrition therapy. This involves doing a comprehensive assessment. We look at body measurements, we look at the biochemical markers, the labs and so forth. We look at lifestyles, we look at dietary indication, and we also do a full physical exam. Once we're completed, we do a nutrition diagnosis, and then we will recommend and put together a targeted care plan with interventions as to how we can get that person to improve the overall lifestyle. So whether it's becoming more physically active lifestyles, whether it's changing diet, whether it's ensuring that person gets adequate amount of nutrients and filling the gap where there are deficits. We know that if we can correct the diet, also if we can maintain an adequate foundation for health, we know that we can see better outcomes when it comes to heart health.
The HEARTS protocol emphasizes the use of effective, affordable, and widely available medications to improve hypertension management.
The medicines that we'll be using
Hola.
Hello? Hello? You're all invited to please take your seats so that we can proceed with the discussions, be able to reconvene.
Some essence, some. As long as 0 calories.
Gracias. Entonces,
Thank you. Let us proceed to the next agenda item. Agenda item 3.3, Scale of Assessed Contributions for 2026-2027. I would like to bring your document SPBA 19/4 to the attention of the subcommittee, and I invite Mr. Ronnie Massa, Director of the Department of Planning, Budget and Evaluation of the Pan American Sanitary Bureau, to please come to the head table and present this item.
President, Director, head table, distinguished delegates, I am pleased to introduce item 3.2, the scale of assessed contributions for the biennium 2026-27. According to Article 24A of PAHO's Constitution, its member states are assessed at the same level as the Organization of American States. So we rely on the OAS scale, and then we apply it here at PAHO. The proposed scale of assessed contributions, therefore, will be important as we proceed to implement the next strategic plan and our first program budget, 26-27. And in the program budget is where we will apply, once there is a decision on the OAS scale, the level of assessed contributions. The amounts will be then included in that proposed program budget at that for that total of $194 million that you saw in the previous item. In keeping with PAHO's constitutional mandate, the scale of assessments to be applied by the Secretariat for the next biennium will depend on the outcome of discussions of the 55th regular session of the OAS General Assembly regarding its own scale of assessments for the period 2026 and beyond. We understand that there are ongoing deliberations about this at the OAS, and based on that outcome, we are collaborating with our colleagues, and when such a decision is made, we will then provide to you for the Executive Committee the application of that scale. We expect those discussions to continue through May up until June, when the Assembly should meet and hopefully adopt the new scale. And at that time, we will need to update, and that puts us in a bind here with the timeline, because as you know, we need to submit the documents 6 weeks in advance for your consideration, so we'll ask for some flexibility as we continue to wait for that outcome of the OAS Assembly. The scale is then adopted here so to apply to other member states, that associate members, participating member states, and we have a methodology for that in a document that your member states approved in a document called CD 6055, and you have the reference in the document there when you made those approvals, so that we, the Secretariat, can apply that to those member states that are not covered in the OAS membership. If the OAS Assembly does not adopt, if by any chance then we have a mechanism to apply an interim measure where we will extend the scale that we have and continue operating. Of course, we will not stop operating and implementing our program budget. Of course, that will also be tabled for your consideration at the Executive Committee, if that scenario is to play out. Therefore, you will see the document is very brief, as we just have an outline at this time, and hopefully we will have the OAS Assembly's results And when they become available, we will update the document accordingly. We welcome your comments at this time, any guidance that you can provide us. Thank you very much, Madam President.
Thank you very much. Now, if you would have any comments on this issue. Mexico, please.
Gracias. Thank you, Madam President. Mexico wishes to thank you for the presentation of this report on the scale of assessed contributions for 2026-2027. And we would like to acknowledge the efforts made by PAHO in order to ensure a transparent and foreseeable process in determining the contributions by our member states in keeping with the normative framework of the organization and also aligned with the scale of quotas of the OAS, as is known to our member states and in compliance with the resolution AG-RES 1 that deals with the program budget 2025 of the OAS. The member states are currently undertaking a review process of the scale of assessed contributions that is to be applied in the coming 3 years. Within this context, consultations are being held with the responsible agencies and levels in the different countries as regard contributions to be notified to international organizations. Mexico reiterates the importance of having a financing program that is just, sustainable, differentiated for PAHO as an essential pillar in order to ensure the stability of its programs to strengthen its capacity to respond when faced with the public challenges, public health challenges in our region, and thus contribute effectively to improving the well-being of our peoples. Thank you, Madam President. Thank you, Mexico. Chile, please. Thank you, Madam President. Our delegation wishes to express its gratitude for the presentation made regarding the scale of assessed contributions, and we wanted to take advantage in order to address a query, those of us that are involved in the discussions at the OAS, and we hope that it will end up in defining the scale of assessed contributions. Now, regarding the procedure that would be followed in case we don't come to a decision by September, please, I seek your guidance. And also, if the decision is to be made a month later, does that affect the final decision to be made by PAHO, considering that this would represent a cost or would have an impact in those 2 years, even if it is within the same calendar year? What real impact could you foresee that this might have if a decision is made a month later, but within the same year? We are waiting for the decision to be made by the OAS. Thank you. Thank you, Chile. Dominican Republic. Thank you very much, Madam President, and thank you for the report that has been submitted regarding the scale of assessed contributions. I have a question regarding the procedure to be followed, because the scale of contributions at the OAS is estimated for 3 years. And I see that here it says a scale of contributions for 1 year. What happens in the coming 2 years if this is based on the OAS scale of contributions? Thank you. Thank you. Anyone else? Any additional comments? If not, we will give the floor back to Mr. Massa. Thank you very much to the delegations, Mexico, Chile, and the Dominican Republic, for your questions. Yes, we hope that it will be concluded. That would be the most practical thing, so that we can have an updated document with the scale of contributions already adopted, and for member states to decide on it. And what is the impact that this would have? Well, it would be an extension of the current scale of assessments. We will continue with the payment that you make to PAHO with the amounts that have been approved in the scale. It is an extension so far, and until the OAS scale of contributions is approved, we would have to go back to governing bodies at PAHO in order to explain how the new scale is to be enforced as soon as we have the OAS scale of contributions. If it is within the year, then next year, with the governing bodies, we would have to discuss this, so we have time. If we have the executive committee in June, we still have 3 months to go so that we can come to the executive committee where this will be adopted. So by the executive committee, if no decision has been made, then we will continue to work with the interim scale of assessments, hoping that by August, we can already have a decision and then work with a new scale. So it is 3 years versus 2 years.
We have a biennium system, so we always apply the existing scale. If there is 1 year that is different, if we need to make an adjustment midterm, then we need to present it to the directing bodies once again. Any change that occurs has to be presented to the directing bodies. What we do is extend the current scale, extend it for 2 years until the new scale is published. We have done that in the past. So we continue with whatever scale is existing until the update is finally provided by the OAS. And that way we can match up with the program budget. So every 2 years we come back to this body and to the other bodies to apply the scale of the OAS to our program budget and explain where we stand. The OAS process will be monitoring it closely. We're in touch with them, and any information you may have, we'd be grateful for you to share it with us, any kind of updates you hear about. And we thank the delegates who are here for their close help to make sure that we are well aligned with the decisions at the OAS. Thank you. Thank you. Let me now offer the floor to Dr. Barbosa. Thank you very much, Madam President, and this is a topic that you heard through the presentation, that we are awaiting the OAS decision. We know that it might take longer than necessary because they have to go through the political negotiation process. As our Director for Planning, Budget and Evaluation has just explained, we cannot automatically incorporate that in our constitution as it has been approved at the OAS. Thank you. Thank you. Let me inform the subcommittee that the discussions will be reflected in the final report. Having said that, we move on to our next agenda, item 3.5, non-state actors in official relations with the Pan American Health Organization. I would like to bring the document SPBA 19.6 to the attention of the subcommittee. The subcommittee is invited to examine the collaboration with 7 of the 8 non-state actors in the context of the triennial review and refer a decision concerning the review of clinical and laboratory standards institute. I inform the plenary that this item will be discussed in 2 parts. In the first part, the Bureau will give a general explanation of the item. In the second part, the members of the subcommittee and member states participating as observers will attend a closed meeting to conduct the review. I now yield the floor to Ms. Mariana Faria Teixeira, Interim Director of the Department of External Relations, Partnerships and Resource Mobilization of the Pan American Sanitary Bureau, to present the first part of the item. You have the floor. Good morning, and thank you very much, Madam President, members, observers, Director, and colleagues. It's a privilege to present agenda item 3.5 of the agenda on non-state actors in official relations with the Pan American Health Organization. At the 55th Directing Council, the framework for collaboration with non-state actors was adopted, known as FEMSA, through the resolution CD 65/3. Through this resolution, member states of OAS specifically replaced the principle that governed relationships between the Pan American Health Organization and the non-governmental entities with FEMSA. These are based on a 3-year plan of collaboration with PAHO and they form the joint agreement of non-state actors' intervention with our organization. The triennial plan has to be developed in accordance with the strategic plan of PAHO and can have no commercial nor lucrative goal. Non-state actors in official relations conduct major or provide major contributions to PAHO and therefore contribute to public health progress in the Americas. Some of the activities carried out by the entities subject to renewal include contribution to the design of a roadmap to develop regional capacities in innovation and manufacturing of inputs and essential raw materials for pharmaceutical, examine and validation of the pertinent pillars of the road security of Rio de Janeiro, Brazil, dealing with the terms of coalitions and surveillance, empowering over 15 organizations of civil society in the Caribbean to promote policies to prevent child obesity, holding of 39 meetings and seminars focusing on the role of clinical laboratories and matters having to do with public health and health emergency with over 6,000 participants. During the period covered by the report, the Secretariat has worked to rationalize the document, aligning it with the PAHO Forward initiative mentioned by the Director in his opening remarks and with our commitment to improve efficiency. This work will continue to render automatic and optimize the process, guaranteeing greater agility. We have not received any request for entry that doesn't comply with the conditions. The yearly average is 1 to 2 requests per year. Last year, however, we received a record number, 7 new requests for entry. During this period, the subcommittee has programmed the review of 8 existing collaborations with non-state actors in official relations with PAHO, all of them subject to their 3-year review. It is recommended to continue official relations with PAHO with the following 7 organizations: Latin American Association for Pharmaceutical Industry, Ross Center for Sustainable Cities of the Institute of Global Resources, Coalition Healthy Caribbean, Latin American Confederation of Clinical Biochemistry, Inter-American Foundation for the Heart, Healthy World Foundation, and Inter-American Society for Cardiology. The Secretariat recommends postponing the condition of the Institute for Clinical and Laboratory Standards Institute, CLSI, to allow time to finalize a stronger plan for collaboration. The Secretariat does not recommend interrupting any review. Last year, the subcommittee approved the review of 8 existing collaborations subject to the 3-year review. In the case of the Inter-American Heart Association, its review was postponed to have time to develop a stronger plan for collaboration. Thank you very much, Madam President.
Gracias.
Thank you. We will now have the closed door meeting. I invite the members of the subcommittee, the legal counsel, Ms. Faria Teixeira, and the technical staff of the Bureau responsible for relations with each of the non-state actors under consideration to remain in this room. I also invite member states participating as observers to remain in the room should they wish to stay. The rest of the participants are invited to take a break, and we invite you to join the meeting again in, let us say, 15 minutes. The other observers to join us again, and then we will continue with the session.
Perfecto.
Very well. As we are now back on the agenda, we are now going to address item 3.6, appointment of one member to the Audit Committee of the Pan American Health Organization. I would like to bring document SPBA 19-7 to the attention of the subcommittee and invite the chair of the working group to report on the item. You have the floor, please.
Thank you, Madam President. Report of the working group charged with evaluating the candidates proposed for membership in the PAHO Audit Committee. Pursuant to Rule 6 of the Subcommittee on Program, Budget and Administration's Rules of Procedure, a working group was appointed to evaluate the list of candidates proposed by the Director of the Pan American Sanitary Bureau, the Bureau, to fill the upcoming vacancy in the PAHO Audit Committee effective June 2025. This working group, comprised of the delegates from Canada, Guyana, and Peru, met on 19 March 2025 at 12:15 p.m. and elected Canada delegate as chair. The working group examined the terms of reference for the PAHO Audit Committee adopted at the 49th Directing Council, Resolution CD 49.R2, the list of 4 proposed candidates and their respective curricula vitae. This supporting documentation was provided to the members of the working group. As a result of its deliberations during the meeting, the working group agreed on the following process. It used the criteria for membership in Section 4 of the Terms of Reference for the PAHO Audit Committee as the basis for evaluating the candidates. It selected 5 critical factors for ranking the candidates and established a scoring system, assigning each factor 1 to 3 points based on its relative importance. The maximum score that a candidate could obtain was 10 points. It prepared a decision matrix that would enable each member of the working group separately to rank each candidate. The members of the working group compared the results of their individual evaluations and reached the following decisions. The score for each candidate were consolidated and the individual results averaged. The candidates were ranked according to their score. Ms. Maria Rios was unanimously recommended as the top candidate for nomination to the PAHO Audit Committee.
Muchas gracias.
Thank you very much, Canada. I will now open the floor to the plenary for discussion.
No. No habiendo ningún comentario.
There being no request for the floor, I would now offer the floor to Dr. Barbosa in case he would like to make any comments. Thank you very much, Madam President. I'd just like to thank the working group, for their task in reviewing the suggestions of individuals who could fill the vacancy on the Audit Committee. The Audit Committee is an external body, and it's important because it supervises the audit processes of the internal auditor as well as the external auditor. As you know, a new one was selected after the former one finished a second mandate, which was the UKNO. So I think it was a unanimous decision, and I think it is good to have the recommendation that you all approved in order to have this individual replacing committee members that have already filled or complied with a second mandate and cannot continue functioning in this body. Thank you very much. I would like to inform the subcommittee that the discussions will be reflected in the final report. Let us then move to agenda item 5.2, draft provisional agenda for the 176th session of the Executive Committee. I would like to bring document SPBA 19-2 to the attention of the subcommittee and invite Mr. Nicolas Lagomarsino, Senior Advisor of the Office of Governing Bodies of the Pan-American Sanitary Bureau, to come to the head table and present the item. Thank you very much, Madam President, Director, delegates. It is an honor to present to consideration of the Subcommittee of Program, Budget and Administration the draft provisional agenda for the 176th session of the Executive Committee to be held in June 2025. The draft provisional agenda is based on a list of topics reviewed by the Executive Committee in last October at its 175th session, and it includes the usual items having to do with regulations, administration, finance, and personnel. as well as issues having to do with the Executive Committee. There are two changes I'd like to suggest or mention. First, the inclusion of a point having to do with the PAHO Forward, having to do with the shared services that was discussed yesterday, and the postponement of the final action plan on the health of workers that will be presented to the directing bodies in 2026. Among matters having to do with program policy, we have this proposed strategic plan discussed today, as well as the proposed program budget, and as well as the scaled of assessed contributions. The agenda also includes the following matters having to do with program policies that respond to current public health issues in the region. A plan of action on prevention and control of non-communicable diseases 2025-2030, a policy to expand equitable access to high-cost and high-price medical services, and an issue on health and migration 2026. There are also many reports that reflect our permanent commitment to monitoring the mandates from the governing bodies of PAHO. This concludes my presentation. Will be happy to answer any question or respond to any comment that member states may have. Thank you very much, Madam President. Thank you very much. I now offer the floor to the plenary for discussion.
El Salvador, por favor.
El Salvador is recognized. Thank you, Madam President, and thank you, Nicolas Lagomarsino, for this presentation. El Salvador, as Vice President of the Executive Committee, is grateful for this report, provisional agenda that is in line with recommendations made at the past meeting, making it more streamlined in a more direct and practical manner so that member states may make better decisions in a shorter time, making efficient use of all the tools available to us. At the same time, we would like to express thanks for the fact that this will take place given the final reports will be presented, which we've seen here, and they're important and highly relevant, as we've seen in the financial aspect or budget, also topics considered by this subcommittee. We're grateful, therefore, for this report. Thank you.
Thank you very much, El Salvador. Any additional comments?
Siendo así,
should there be none, microphone for the President, microphone. I would like to inform the subcommittee that the discussions will be reflected in the final report. We now move on to our next agenda item 6, other matters. Director, are there any other matters that you would like to bring to the attention of the subcommittee? No, Madam President. And now let me give the floor to any delegate, anyone present who would like to deal with any issue under this agenda item. I would like to inform the plenary that the deliberations of the subcommittee will be reflected in the final report, and then we move on to the last item on the agenda, which is at the closing of the meeting. I now invite the director to make some closing remarks. Please, Director. Thank you, Madam President.
15th session of the Subcommittee on Program, Budget and Administration, esteemed Mrs. Margarita Perez Villa Senor, Coordinator of Institutional Strategy in the Ministry of Health of Mexico. Vice President, esteemed Dr. Madeleine Bird, Manager of the Multilateral Relations Division Office of International Affairs for the Health Portfolio Public Health Agency of Canada. And our rapporteur, esteemed Dr. Victor Joseph Melti Campos, Diretor-Geral Director General of the Office of International General Cooperation in the Ministry of Health of Peru, distinguished member state delegates, observers, and PAHO staff. In the past 2 days, we have completed the revision of 18 agenda items in preparation for our Executive Committee in June and Directing Council in September this year. We have reviewed the unaudited financial data for 2024, including total revenue of nearly 1.3 billion. We saw that the PAHO's level of collect assess contribution showed a decrease in 2024, and we currently have pending collections totaling more of $50 million. We once again ask member states support in making their timely payments to the organization in order to not jeopardize our delivery of technical cooperation. We discussed the revenue from procurement activities, including the revolving fund for access to vaccines, the strategic fund for public health supplies and reimbursable procurement, reached around $1.1 billion. We highlight that we expect this amount to continue to decrease as we move past the pandemic response. We presented the draft proposal of PAHO's strategic plan for the period 26-31, which is a document that has been elaborated by member states with the support from the Secretariat in order to establish the impact, outcomes, and targets that the organization will prioritize in the following years. A final proposal will be presented to member states' deliberations at the Executive Committee in June this year after another 2 rounds of negotiation conversations among our member states. We present the proposed outline of the program budget of the Pan-American Health Organization for the biennium 26-27, which will establish outputs aligned with the new strategic plan, ensuring transparency, efficiencies, and clear definitions of the contributions from the Bureau. We are presenting a flat budget of $800 million in comparison with the previous biennium. A portion of this budget envelope is expected to be funded with co-voluntary contributions from partners and donors. These funds that are flexible are very important in order to attend the demands of technical cooperation of the organization and also as a response to the no increase in the assess contribution in the last 12 years, which translates in less $75 million for PAHO due to inflation and increased costs of staff and other expenses. We received an update of PAHO's human resource management, which included the steps being taken to have more efficient selection processes and the People Strategy 2.0 lines of action to continue improving the management of our human resources. Let me now switch to Spanish.
We have also received an update on the plan for the implementation of the Master Fund, the sub-funds, and the progress made in the renovation of the main offices of PAHO and the country offices. Yesterday, we had an information session, PAHO Forward, Initiative of Shared Services, that attempts to improve the efficiency and effectiveness of administrative functions of the organization through the modernization from a low-cost location in the region of the Americas. We've also presented the list of candidates in order to cover the vacant position of the Audit Committee of PAHO and the criteria for their selection, which was just presented. We heard the proposal from the committee and the working group that was established for that purpose with the unanimous decision on the candidate and the name of the candidate that will be presented. We would like you to know that no new request has been received from non-state agents in official relations with PAHO that ought to be considered by the subcommittee. However, 8 entities, were reassessed as a part of the 3-year exam that is part of the process. I believe that we had a sort of an outbreak of requests last year. There was a record number, and usually we get 1 or 2 a year, but last year we got 7. So it seems to me that the queue was smaller, but I believe that it is important that in all relations that we establish with non-state actors, that we invite them to maintain official relations. That is the best way of ensuring transparency, knowledge by member states, that who are these entities, who are these actors, and how they contribute to the organization. The report on strategic matters between PAHO and WHO was also presented, reiterated the commitment of PAHO in supporting our member states in the process related with the INB, the Intergovernmental Negotiation Body, because of its acronym in English. We've also discussed the proposed budget for the program for 26-27 of WHO. That is still following a discussion process and that will be submitted to member states in May to the consideration of member states of WHO. We also continue fighting for an equitable distribution of resources that will do justice to our region. I would like to express our gratitude to our Deputy Director, our DD, Marilu Valdez, for her dedicated work as Secretary of the SPBA, and to all our staff, including the governing body's office, for their dedicated work so that this meeting could have happened with so much success. I also want to express my most sincere gratitude to our talented interpreters. Many a times they have the capacity to translate even those of us who speak at full speed, without which we would not be able to do our job in such a fluid way, and also to our translators who have made it possible to have all the documents for this meeting in the different official languages of the members of the committee. In this case, for this year, we had them in English and in Spanish. I hope that you have a safe return back home, and we'll see you back in the meeting of the Executive Committee in June. Thank you very much.
Muchas gracias.
Thank you very much, Dr. Barbosa. And I only want to take a couple of minutes of your time to address my closing remarks. Distinguished members of the subcommittee, distinguished official colleagues, delegates, distinguished Dr. Jarbas Barbosa, I would like to thank you for providing me this possibility of presiding over this 19th session of the Subcommittee on Program, Budget, and Administration. In the course of these 2 days of work, we not only complied with the objectives of the agenda, but we also made headway in our commitment with PAHO so that we can make sure that this continues to be a key tool so that the population in the region of the Americas will be healthier and more prosperous in an environment of equity and resilience. I would like to acknowledge how, in an environment of great uncertainty, PAHO is deploying major efforts in order to conduct its affairs with prudence and responsibility. I believe that we all recognize that. I also wish to appeal to all member states to continue committed to the organization, but also to be flexible, clear in our priorities, and following closely the challenges posed by the international environment. Last but not least, I'd like to thank the members of the Bureau, the head table, Dr. Barbosa and Nicolas, without whose advice and support and his entire team, nothing would have been possible, and for their great support at all times. And in general, I'd like to thank the team at headquarters for the effort made in order to bring this meeting to such a success. I hope to continue with these exchanges when we come to the meeting of the Executive Committee that is to take place this next June, and I will be very happy to meet with all of you again. Thank you very much, and we'll see you in June. And then we officially declare this 19th session of the Subcommittee on Program, Budget, and Administration closed, formally closed. Thank you all.